Welcome back to Anatomiqa. In this series of sessions, I will be discussing various aspects of bone. The learning outcomes of this session includes explain the functions of bones, list the bones of axial and appendicular skeleton, describe the different ways in which bones are classified with suitable examples, discuss the parts of a young long bone and its clinical significance, mention the blood supply and nerve supply of bones. Now, the fourth and fifth learning outcome will be dealt in a separate session. Skeletal system includes bones and cartilages. It forms the main supporting framework of the body and is primarily designed for a more effective production of movements by the attached muscles. The bones are specialized, hardest, strongest, constantly changing connective tissue and undergoing continuous turnover throughout life. Despite its hardness and high calcium content, the bone is very much a living tissue. It is highly vascular with a constant turnover of its calcium content. It shows a characteristic pattern of growth. It is subjected to disease and heals after a fracture. It has greater regenerative power than any other tissue of the body except blood. It can mold itself according to changes in stress and strain it bears. It shows disuse atrophy and overuse hypertrophy. The functions of bone are many. Bones form the rigid framework of the body, give shape and support to the body, resist any form of stress and strain. They provide surface for the attachment of muscles, tendons and ligaments, serves as levers for the muscles and help in the movement of the body or the parts of the body. Some bones such as skull, vertebral column, thoracic cage and pelvis gives protection to certain viscera like brain, spinal cord, thoracic organs and pelvic organs respectively. They contain bone marrow which manufactures blood cells. Bones act as the storehouse of calcium and phosphorus. Bones store 97% of the body calcium and phosphorus. Bone marrow contains reticular endothelial cells which are phagocytic in nature and take part in immune responses of the body. The larger paranasal air sinuses like ethmoidal sinus affects the timbre or resonance of the voice. In the structure of bone, first we will see the gross structure or macrostructure of bone. Later in another session we will discuss about the microstructure of bone. When we take a section of bone and observe under naked eye, the bone consists of outer compact and inner spongy bone. Compact part is ivory-like and extremely porous. Spongy part, also known as the cancellous bone, is composed of a network of trabeculae. The trabeculae are arranged along the lines of maximal internal stress and are adapted to resist stress and strain to which a bone is subjected. Each bone is covered by the periosteum except at the articular surface at the ends of each long bone and sesamoid bone. The articular surfaces are covered by articular cartilage. The interior of the adult long bone presents a cylindrical medullary cavity which is filled with bone marrow and is lined by a vascular membrane known as endosteum. So that was the brief description of the macroscopic structure of bone. Now, coming to the classification of bones. Total number of bones in man is 206 bones, but the number is variable. The bones can be classified into 6 groups based on the following features. it can be classified based on the position, region of the bones, shape of the bones, gross structure of the bones, microscopic structure of the bones, based on the location and based on development of the bones. In the first group of classification based on position or region, the bones are further classified into axial and appendicular bones. Axial bones are the bones which are present in the head, neck and trunk. They are the skull bones. Under skull bones, there are 8 bones in the cranium, 14 bones in the face, single hyoid bone present in the neck. Auditory ossicles are totally 6, 3 on each side of the ear. 26 vertebrae, 1 sternum, paired ribs which are 12 on each side, totaling to 24. The second part of subclassification under the position or region is appendicular bones. Under a pair of upper limbs, there are total of 64 bones, 32 on each side. The following are details of upper limb bones: 2 clavicles, 2 scapulas, humerus 2, radius 2, ulna 2, carpals 16 bones, metacarpals 10 bones, 5 on each side, phalanges 28 bones, 14 on each hand. The number specified is total number including both sides, right and left sides. Under a pair of lower limbs, there are 62 bones altogether, 31 on each side, right and left. The following are the details of lower limb bones: 2 hip bones, 1 sacrum, 1 coccyx, 2 femurs, 2 tibia, 2 fibula, 14 tarsals, metatarsals 10 bones, phalanges 28 bones. In the second group of classification based on the shape, the bones are further classified into long bones, short bones, flat bones, irregular bones, pneumatic bones, sesamoid and accessory bones. Let us see the brief details of all these subclassification of bones. The long bones are those in which the length exceeds the breadth. They are confined mostly in the limbs where they act as levers for the muscles. All long bones are weight bearing. An adult long bone presents a shaft or body or diaphysis, and the 2 ends, or it is also called as epiphysis. The shaft is narrowest at the middle and gradually expands at each end. It presents 3 surfaces separated by 3 borders. The ends or epiphyses are enlarged, articular and capped with articular cartilage. The shaft consists of a tube of compact bone and contains the medullary cavity, which is filled with bone marrow. Long bones ossify or are preformed in cartilages. The structure and parts of the long bone along with neurovascular supply will be dealt in detail in a separate session. Long bones may be subclassified into 3 types: typical, miniature and modified long bones. A typical long bone presents a diaphysis and at least 2 epiphyses, one at each end. Most of the long bones of the limbs are examples of typical long bones. Miniature or short long bones presents a single epiphysis at one end of the bone only. Metacarpals, metatarsals and phalangeal bones of the fingers and toes are examples of this type. Epiphyses of all metacarpal or metatarsal bones are directed towards the head except the first, where they are directed towards the base of the bones. Modified long bones. The clavicle is the only bone classified as a modified long bone, in spite of the fact that it is devoid of medullary cavity and mostly ossifies in membrane. Then why is it included under long bones? This is due to the fact that functionally the clavicle is weight bearing and transmits the weight of the upper limb to the axial bones like any other long bone. Coming to the second subclassification, that is short bones. Typically, each short bone is cubical in shape and present 6 surfaces. Out of these, 4 surfaces are articular and the remaining 2 surfaces give attachment to the muscles, ligaments and are pierced by blood vessels. Short bones are identical in structure with the epiphysis of the long bones. Carpal and tarsal bones are examples of short bones. All short bones ossify in cartilage after birth except the talus, calcaneum and cuboid bones which start ossification in intrauterine life. Flat bones consist of 2 plates of compact bone with intervening spongy bone and marrow. Most of the bones of the vault of the skull, scapula, ribs and sternum are examples of flat bones. The intervening spongy tissue in the bones of the vault of the skull is known as the diploe, which contains numerous veins. Flat bones form boundaries of some bony cavities and appear in those areas where protection of essential organs is of paramount importance. Irregular bones are irregular in shape and do not fit with other classifications. They consist mostly of spongy bone and marrow with an outer covering of compact bone. Most of the bones of the base of the skull, vertebrae and hip bone are examples of irregular bones. Pneumatic bones, 4 in number, maxilla, sphenoid, ethmoid and frontal are the pneumatic bones. These bones contain air-filled spaces which are lined by mucous membrane. Pneumatic bones are confined in close proximity to the nasal cavity from which invagination of the mucous lining invades the neighboring cranial bones at the expense of the diploe tissue. The functions of pneumatic bones are: it is economical and makes the bones lighter. It helps in resonance of the vibration of sound. It acts as an air conditioning chamber by adding humidity and temperature to the inspired air and making the air suitable for the purpose of the body. Sometimes infection from the nasal cavity extends into the air sinuses and produces cold in the head. Sesamoid bones. The word sesame is Arabic in origin. Sesame means seed. These bones develop as seeds in the tendons of some muscles. When these tendons are subjected to friction during the movements of joints, so submerged bones act as pulleys for muscular contraction. Peculiarities of sesamoid bones include: they develop in the tendon of muscles, ossify after birth, they are devoid of periosteum, they do not have Haversian system, there is absence of medullary cavity, they are related to articular or non-articular bony surface, and the surfaces of contact are covered by hyaline cartilage and lubricated by a bursa or synovial membrane. The functions of sesamoid bone are: it holds the tendon slightly further away from the center of the joint and protect it from wear and tear, reduce or minimize friction on tendon, alter direction of tendon and the pull of muscle, maintains the local circulation, protect the vessels and nerves. The examples of sesamoid bone are: patella in quadriceps femoris is the largest sesamoid bone, pisiform in flexor carpi ulnaris, 2 bones beneath the head of first metatarsal in flexor hallucis brevis, 1 bone known as the fabella in the lateral head of gastrocnemius, 1 in peroneus longus at the cuboid bone, sometimes a bone known as rider's bone in the tendinous origin of adductor longus is present in professional riders. Accessory or supernumerary or vermian bones are not regularly present. This may appear with an extra center of ossification in a bone and fail to unite with the main bony mass. Accessory bones are commonest in the skull. Examples are sutural or vermian bones and interparietal bones. In X-ray films, they may be mistaken for fractures, which may be a challenge faced in medico-legal practice. However, in paired bones, these are bilateral and their edges are smooth and covered with compact bone, unlike fractured bones where callus is formed and the edges are rough. With this, we have completed the classification of bones based on the shape. Now coming to the classification of the third group based on macroscopic or gross structure. It is classified into compact and spongy bone. Compact bone is dense in texture like ivory and is extremely porous. It is best developed in the cortex of the long bones. This is an adaptation to bending and twisting forces, which is a combination of compression, tension and shearing forces. Cancellous or spongy or trabecular bone. It is open in texture and is made up of a meshwork of trabeculae, that is rods and plates between which are marrow-containing spaces. The trabeculae are arranged in real pattern, best adapted to resist stress and strain. If there is an alteration in strain to which cancellous bone is subjected, there is rearrangement of trabeculae. This is present at the end of long bones and lining the marrow cavity. Classification of fourth group based on microscopic structure. It is classified into two types, lamellar and woven. Lamellar bone, most of the mature human bones, whether compact or cancellous, are composed of thin plates of bony tissue called as lamellae. These are arranged as branching curved plates in the cancellous bone and as regular concentric cylinders in the form of Aversian system in a compact bone. Woven bone is also called as non-lamellar bone or primary bone or immature bone. It does not display lamellar appearance. The collagen fibers and bone crystals are arranged randomly. That is, it is characterized by the irregular interlacing arrangement of collagen fibers running randomly in different directions. It contains large number of cells per unit area and are randomly arranged. And the matrix has more amount of ground substance and reduced mineral content. Please note, the primary bone is deposited on hyaline cartilage. Primary bone is acidophilic while the hyaline cartilage is basophilic. It is seen in fetal bone or embryonic skeleton, fracture repair or healing, cancer bone, and in cortical and cancellous bone in states of rapid growth or bone replacement or high bone turnover since it develops more rapidly. It is replaced in the normal skeleton by lamellar bone after completion of growth. Based on the location, the fifth group, bones are classified as exoskeleton and endoskeleton. Exoskeleton are the bones which are located subcutaneously just deep to the skin and can be felt. Examples for exoskeleton are cranial vault, maxilla, mandible, clavicle, and dentine of the teeth. Endoskeleton are the bones present deep to the muscles and cannot be felt. Examples of endoskeleton are bones of the limbs and vertebrae. Classification of sixth group based on ossification or development. It is classified into membrane, cartilaginous, membranocartilaginous, somatic and visceral bones. Membrane bones are bones developed from intramembranous or mesenchymal ossification. They are directly derived from the mesenchymal condensations. Examples are bones of the vault of skull such as frontal and parietal, then the facial bones like maxilla. Cartilaginous bones are bones developed from intracartilaginous or endochondral ossification, where the bone replaces the preformed cartilaginous models. Examples are bones of limbs, vertebrae, and thoracic cage. Membranocartilaginous bones are bones which develop partly in membrane and partly in cartilage. Examples are clavicle, mandible, occipital, temporal, and sphenoid bones. Somatic bones, all the membrane and cartilaginous bones belong to somatic bones. Visceral bones, these are few and develop from pharyngeal arches. Examples are hyoid bone, part of mandible and ear ossicles. With this, we have completed classification of bone. To recap, until now we have discussed the introduction, functions, and the different types of classification based on position or region of the bones, shape of the bones, gross structure of the bones, microscopic structure of the bones, location and development of the bones. In the next session, I will be discussing on the terms used for describing the bone features.